Ministers and doctors have both vowed to fight on as the first all-out doctor strikes in the history of the NHS ended in England without any major problems. The last 2 days have seen junior doctors walk out of routine and emergency care in protest against the imposition of new working conditions. NHS bosses said hospitals had coped admirably during the stoppages. But there looks to be no end in sight to the dispute, with doctors' leaders not ruling out more strikes. Sources at the British Medical Association said they would now spend the coming days and weeks considering the next options. But they were adamant this would not be the end of the protest against the imposition of a new contract. Options on the table include everything from a series of rolling strikes to refusing to do vital paperwork. Meanwhile, two legal challenges are still working their way through the courts. Some doctors have even talked about encouraging mass resignations from the health service. A source said, "The government is adamant it won't give in, but so are we. Doctors are not ready to back down." But government sources responded by saying both the Department of Health and Number 10 had made it clear any escalation in strike action would not stop imposition of the contract from this summer. "The government is confident in its position and we've made that clear to the BMA." Wednesday's stoppage ended at 1700 hours BST, bringing to an end 2 days of industrial action which saw 78% of doctors who were expected to work not turning up. But hospitals told the BBC services had run smoothly during the stoppages. Some even said it had been quieter than expected, with consultants and nurses covering emergency care. It meant no NHS trust had to trigger the emergency protocols which allowed them to call for junior doctors to return to work if patients were at risk. NHS England's Anne Rainsbury said this was down to careful planning in the lead-up to the strike. More than 100,000 routine appointments and nearly 13,000 operations were postponed to allow staff to be redeployed. "We're not going to pretend the last 2 days have been easy, but the NHS has remained open to business for patients. The health service has coped admirably." Patients who ended up in hospital reported they had received good quality care. Liam Walker, 35, from London, said his partner had been well cared for while in labour. "There are 3 consultants instead of 3 juniors," he said. "We've had fantastic treatment." Retired health visitor Maureen Gaunt, from Dewsbury, West Yorkshire, went to accident and emergency for a dog bite. "The staff were very welcoming," she said. "I waited no longer than 20 minutes. Even the staff said it was quiet." But patients who have seen their treatment delayed have spoken about the problems it has caused. Senior nurse Wendy Jensen's daughter Hannah, 21, has been waiting for treatment for her brain tumor since before Christmas. She was due to be admitted on Tuesday, but that was postponed. Understandably, Hannah is devastated and very annoyed about this, her mother said. But Ms. Jensen said she still supported the junior doctor's action, adding, "I have seen how dangerous sleep disruption in doctors."